My name is Drew Contreras. I'm a physical therapist. I primarily work in outpatient orthopedic sports medicine settings. The majority of patients I work with are either law enforcement, military, police, and kind of what we refer to as tactical athletes. Another large segment that I've worked in is the executive medicine population, working with high-level CEOs and government officials. What I know about the current opioid epidemic in America is that it is escalated from something that people were concerned about to a national health emergency. Now, a lot of people would say, well, this isn't a problem in my community. This doesn't happen here, or this isn't in where I live. And I would say that's completely false. The big misconception is that the opioid epidemic primarily affects recreational drug users and the stigma that comes along with that. The reality is that over half of all deaths from the opioid epidemic actually occur from prescription medication. And the other half of people where it's recreational use, over 2/3 of those individuals became addicted because they had a prior medical treatment that used opioids. And it's time that the healthcare professionals step up and do something to help with it. The Safer Pain Relief Campaign is an initiative where we're partnering with hands-on professionals who have patients who may be involved in suffering from the opioid epidemic. So we're trying to provide them with initiatives of information, research, education, tools, all kinds of alternative techniques so that we can get patients pain relief, deal with their musculoskeletal problems, and find ways to treat them without resorting to opioids. I find that a good technique when trying to treat patients for their musculoskeletal joint pain is to use various approaches, because no individual patient gets the same response from every treatment. So you have to have several options in your treatment toolbox, if you will. So as a clinician, sometimes patients respond very well to using kinesiology tape, which is a great adjunctive treatment for dealing with their pain. Sometimes using a topical component like BioFreeze is a great alternative, and it gives patients a way for them to self-manage their pain without using an addictive medication. And to a larger extent, there's several soft tissue tools and stretching techniques that you can use with various things to make sure that people are able to restore their joint range of motion and their normal function, which then leads to their pain relief. Using CLX bands has been an excellent treatment form for doing therapeutic exercise with those patients to get them where they need to be. The biggest problem people have is they have to understand how to deal with their pain, how to overcome it, how it's going to affect their life. And as practitioners who deal with this and who work with people, this should be something that all physical therapists should be involved in.